So late in January this year, 2025, the health minister announced changes, which is going to affect a lot of nurses in terms of the registration requirements in Australia. So specifically, that's AFRA. A lot of the nurses would need to do the OSCE and NCLEX in order to be able to get their registration. Those nurses who had done their original nursing qualification in what we would call non-target countries. Non-target means countries that were not the US, UK, Canada, Ireland, Hong Kong, New Zealand and Australia. So those who got their nursing studies in another country often, you would get a Stream 2 or Pathway 2 when you would go to do a self-check in AFRA, which would require you to do the NCLEX and to travel to Australia to do the OSCE. Others would go via New Zealand because New Zealand needed these requirements. But as we know, New Zealand introduced its own OSCE on the 4th of December in 2023, and then they have an NCLEX equivalent called the IQN theory that they introduced on the 1st of July. This has been really confusing for nurses. But what is exciting? Many years ago, the governments of all of these countries had done reviews to try and align the registration processes. So this new announcement, the new Pathway 1, is around nurses who didn't do their original studies in one of those target countries. Again in US, UK, Canada, Ireland, Hong Kong, New Zealand and Australia. But they're now working in those countries and they have their PIN in the US, UK, Canada, Ireland, Singapore or Spain. And if they have at least 1,800 hours of clinical experience. Australian lawyer Rhea Fawole, owner of Solvi Migration, emphasized that it has now been proposed that the nurses will be now eligible for direct registration once they've got their 1,800 hours of clinical experience and the registration in one of those countries, for example NMC-registered UK nurses. She also stressed that it's better to process as early as now so as to skip the part of preparing the needed requirements when the new pathway is confirmed. You can follow Rhea Fawole on Instagram @SolviMigration. This is your nurse JP.